name is Lynn and this is my sister Nikki, and we are distributors for Ireland and the UK for this wonderful product, Maybe Baby. Maybe Baby is a 98% accurate, fully reusable saliva ovulation tester, and we're going to show you now how easy it is to use and what a useful tool it is when you're trying to conceive. In 1957, scientists in the University of Turin in Italy discovered that estrogen in a woman's saliva could reflect her fertility at any one time. When dried, estrogen crystallises to form a pattern which resembles fern leaves, and this can be clearly seen under a microscope during ovulation. With this research in mind, Optics, who manufacture contact lenses for the European market, developed Maybe Baby. Their aim was to develop a product of the highest quality, so they ensured that Maybe Baby had all the relevant certifications. Using Maybe Baby is really straightforward. You just take the cover off, pop the lens out of the unit, lick the underside of the lens to deposit your saliva sample. Now you don't need a lot because the more you have, the longer it takes to dry. So just pop it back in and leave it for 10 or 15 minutes or maybe up to half an hour, and you can then test your result. So to do this, you just bring the unit up to your eye and press the button at the bottom to illuminate your pattern. Now if it's at all blurry, all you have to do to refocus it is to twist the lens in the unit like that. As Nikki mentioned earlier, Optics are a contact lens manufacturer, so it's a really high quality lens and they have made it so that it'll suit every eyesight. Now the best time to use your Maybe Baby is when you haven't eaten for about 2 hours. So obviously first thing in the morning, just before lunch or just before dinner are good times. Now we would recommend when you start using it first, try it in the morning and the evening. The reason for this is because we actually detox during the night through our tongue. So for some people, this may affect their morning reading. So what you do next is actually record your result on the chart provided in the box. And we'll come back to this in a little while, just to explain why charting is so useful and important. From your sample of dried saliva, you'll see one of 3 patterns. Pebbles and dots, and this is a non-fertile period. A transitional pattern, which consists of pebbles and dots and small ferns, may be seen 1 to 3 days prior to ovulation. So basically, once you see a change in your pattern, this is the best time to try to conceive. Full ferning indicates your day of ovulation. Some women may find that the fern pattern covers the full of the viewfinder. For others, they may find that it's just in a particular corner of the viewfinder. Both of these are perfectly fine, because ovulation will be shown by dense ferning. So coming back to the charting, this is your Maybe Baby chart, and this is an example of my first chart when I started using it in the beginning. So basically all you do is start charting your results on day 1 of your cycle, and you'll be able to see the length of your cycle, the regularity of your cycle, regularity of your ovulation, and the length of your luteal phase. Now your luteal phase is from ovulation to menstruation, and this should be about 14 days ideally. Now as you can see from my chart, mine was only 18 days. So this indicated that my progesterone was too low, and this was actually later proved with a blood test. Now the other thing is that we all assume that we ovulate between day 14 and 16, which is about average. However, you can ovulate as early as day 8 or as late as day 22. You can ovulate twice in a month occasionally as well. So if you're using Maybe Baby every day, you're not going to miss that window of opportunity for conceiving. When you're charting, you should start your first cycle at the top of your first column. And then again, when you're finished one cycle and you're starting your next one, go to your second column, and obviously the same for all the subsequent months. And the reason for this is when you chart this way, your patterns become very obvious. For perfectly fertile couples, using Maybe Baby will maximise your chances of conceiving as quickly as possible. So if there are any issues at all, after several months have passed and you decide that you would like to go and see your GP if things aren't happening, then you can bring your chart along, and this is actually a really good tool for them as a starting point to know what needs to be done. And also it'll help you pinpoint the days when you need to have your blood tests done. Another good tip with your chart is to actually note on it if you have a day when you're particularly stressed or if you've been ill, just so that you can see if it's having any impact on your ovulation. Now, for example, if somebody has a big exam coming up and they normally ovulate at day 14, they may not ovulate until the exam is over, so maybe it could be day 18 or 19. I think that if we can see that stress is having an impact on our fertility, we will definitely do something about either trying to eliminate it if we can, or trying to manage it better. Okay, so now we're going to go through the contents of your Maybe Baby box. And obviously there is the Maybe Baby unit itself and the 6-month chart, which Lynn has already gone through with you. Also provided is a lint cloth, and this is to be used to clean the lens of the maybe baby. It's important that you don't use anything else to clean it, as it may cause damage. Lastly, we have the instructions leaflet. It's important to read through this carefully, as it is a lot of valuable information on how to use the maybe baby, your cycle, and also it has a diagram of the different components that make up the maybe baby. So if you find you've any queries at all regarding your maybe baby, please don't hesitate to give us a call. For customers in Ireland, please call 1890 253 220. For anybody in the UK who'd like to give us a call, please phone 00353 4943 62742. Alternatively, you can email us on info@wlntrading.com. As Nikki said, please do call us if you have any questions at all, because we really know what a fantastic tool this is for teaching you more about your own individual fertility. So all that's really left for us to do is to wish you all the very best of luck and lots of happy and healthy babies. And in the meantime, take care and good luck.